EMR is fabulous. We have different searches that we do regularly, reminders that come up for certain patients depending on what they're due for. Yeah, it's great. Sometimes we don't have the correct data, and then we just go in and adjust the search and do it again.
Some of the early challenges in the role were streamlining our EMR, first of all. It was important to us to make sure that we could find something that worked for us in our EMR. We don't like to use paper anymore. So we built a template in the EMR, and we needed the assistance of our EMR team to help us do that. So that took a little while, lots of testing, and we used one clinical assistant, Janice, who did all of the testing for us. So she would test, come back with some results, say this worked, this didn't work, and we'd have to tweak it again. And so that took a month or two to get that all completed. And then once we had that, that was probably the biggest challenge. But we were able to overcome that by using our EMR support team, and they were very good to help us out.
I don't know how we could do our job without an EMR. It is a valuable entity, as it would be painstaking to have to go through paper charts to get all this information. It would be virtually impossible.
We have a new EMR, and there are some changes that our panel managers have put into place in that EMR. There's places where at the top of the chart it can be highlighted if they're missing certain things, such as we haven't talked about smoking cessation, we haven't talked about their cancer screening, that sort of thing. In addition, our panel managers do go through and make what are called stamps, and so for a diabetic follow-up, the stamp is sort of the same every time it comes in the patient's chart, so it's a very well-organized way to look at things, and it also helps for comparing results, so you can quickly scroll back to their last diabetic visit, see the things in an organized fashion, and see if they've made improvement or if they've fallen off a little bit. And it just helps to sort of organize the chart a little bit better.
When we first started using the EMR, and particularly with panel management, we would have these rules which were sort of guidelines to do things, but they were so unreliable that we basically ignored them as physicians. In other words, it would say so-and-so is due for a pap test, and in fact, at least half the time she wasn't. So it was a rule that was just ignored because it was so inaccurate. Whereas once we did our panel management and went through, especially the stuff with Michelle with the TOPS and getting the Alberta Cancer Board, whether they'd actually had their pap, where they had it, it became believable, so that when you saw that they actually needed a pap test, you knew that they did. The EMR, it really is a powerful instrument, but it needs to be trained somewhat, because it's has a lot of information, but unless it's put in a proper fashion, it's not nearly as useful as it could be. Particularly with our colon cancer screening, when we started that particular process, whether people had their FIT test or their fecal occult blood test done or their colonoscopy, it was in so many different places in the EMR. It was essentially unusable as well, and it took I would say Suzie and Cicely, it took them a couple of months to get it so it was believable and accurate. And now it is, it is great. It is rare. Now I would say once every month maybe I would have someone that said, well, I've had that test before. And lo and behold, they have had. But when we first started, it was like almost every second patient. Oh, I just had that 3 months ago. It's like, oh, so you really have to take the time to get it set up properly.
For complex care management, using the EMR to create lists of patients that qualify for complex care. There's background work that is involved with that process, but once it's all set up, you can create lists and recall patients to have their complex care done, and that's a visit with a physician one-to-one, where they address all their goals of care, along with plans of care for the following year. And we use those lists regularly for that. Another example of panel management and using our EMR is in our anticoagulant clinic. We have an RN that is in charge of our anticoagulant clinic, and in doing that we have created a set of criteria and rules within the EMR to identify any patient that is, say, more than 30 days due for their blood test. and we can kind of monitor those people, run regular lists of those patients that are due for or overdue for their blood work, and we can track those patients down and find out what's happening with them if we see that it's been 6 weeks or more that they haven't had their blood work done, and we call them individually as well. So it works really well for monitoring that way.